Hello. So, what is the importance of accessible healthcare, you may ask, upon human well-beings? Well, accessible healthcare is crucial for promoting public well-being and by preventing adverse health outcomes. A couple key points on the importance of accessible healthcare includes timely access to healthcare services. This is by including preventative care, early diagnosis, and treatments where these become essential for achieving the best possible health outcomes, allowing for early detection and management of these diseases, reduce the risk of complications as well as premature deaths. Healthcare facilities are considered as another key point to the importance of accessible healthcare, such as primary care centers or vaccination programs. This is a virtual role in preventing and managing communicable diseases. These vaccinations can protect populations from deadly outbreaks, while early diagnosis and treatments can prevent illnesses from becoming so severe. Another could be good access to care leads. This is so that it improves health outcomes, as patients are more likely to receive preventative care screenings and timely treatment. This can help catch health problems early whenever they are the most treatable and manageable. By managing chronic health conditions effectively, improving the quality of our life before it becomes so severe. Patients with access issues may delay seeking treatment until their condition becomes so severe, leading to higher healthcare costs. Good access care can also help reduce overall costs by enabling timely and appropriate care. Lack of access to health care disproportionately affects vulnerable populations such as those with low incomes, racial or ethnic minorities, and rural residents. Ensuring accessible healthcare is crucial for achieving health equity and reducing disparities in health outcomes. Oklahoma can learn from the successes of states like California, Oregon, New York, etc. After implementing Medicaid expansion, in California, over 3.7 million residents gained coverage, increasing preventative care utilization and reducing medical debt, with hospitals saving an estimation of $3.2 billion from reduced uncompensated care costs from 2014 to 2015. Oregon saw a 38% decline in uninsured low-income adults from 2013 to 2017 by improved health status, reduced depression rates, and increased preventative care usage. Oregon also witnessed increased utilization of preventative care like mammograms and cholesterol screenings. New York provided coverage to over 1 million newly insured individuals, reducing the uninsured rate among low-income adults by 64% from 2013 to 2018, increasing access to substance abuse and mental health services, alleviating financial strain, and improving employment rates. While Oklahoma specific economic data is limited, Medicaid expansion generally injects federal funds into state economics, creating jobs across healthcare and support services. This is increasing tax revenue from newly employed individuals and businesses. Oklahoma can maximize these economic benefits through streamlined enrollment and outreach efforts as well. Oklahoma.gov states that Medicaid expansion brings a significant influx of federal funds into the state's economy. For every dollar Oklahoma spends on Medicaid expansion, the federal government will cover 90 cents through an enhanced federal matching rate. This represents a substantial investment of federal tax dollars into Oklahoma's healthcare system and overall economy. This injection of funds can create jobs across healthcare providers, support services and industries benefiting from increased consumer spending by newly insured individuals. It can also increase tax revenue as newly employed individuals and thriving businesses contribute to the tax base. While concerns about administrative costs and privatization have been raised, reputable resources suggest expansion and then alleviate financial strain on individuals and families, improving employment rates, contributing to economic growth through consumer spending and job creation, and underscore the potential positive impact on Oklahoma's economy and residents' well-being alongside the benefits of accessible health care. Medicaid expansion leads to increased utilization of preventative services like cancer screenings, cholesterol checks, and well-child visits, allowing early detection and management before conditions become so severe or costly. KFF states expansion is associated with reduced rates of hospitalizations by improving access to primary and outpatient care and preventing avoidable hospitalizations and associated costs. Expansion narrows coverage gaps across demographics in Oklahoma, benefiting over 200,000 low-income adults aged 19 to 64 years old who were previously ineligible. It reduces disparities for minority communities facing significant barriers by increasing insurance coverage and access. Rural areas struggling with provider shortages and hospital closures benefit as expansion strengthens rural hospitals financially. Accessible healthcare is a social justice issue as a lack of affordable care disproportionately impacts vulnerable communities, perpetuating poverty and poor outcomes. Medicaid expansion addresses these systemic inequalities, ensuring all individuals can lead healthily, productive lives regardless of socioeconomic status. So, my fellow classmates, the evidence is very clear. By expanding Medicaid access is a crucial step towards improving public health, boosting our economy, and promoting equity for all of our citizens. Our central claim is that Oklahoma should learn from other states' Medicaid expansion successes and implements evidence-based policies to improve public health and economic outcomes. This is supported by compelling data and real-world examples. So first, the Medicaid expansion will inject much-needed federal funds into Oklahoma's economy, creating jobs across various sectors and improving overall financial stability. By leveraging this investment, we can drive economic growth, increase tax revenue, and strengthen vital public services. Secondly, accessible healthcare leads to better health outcomes, reducing medical debt, and as well increased utilization of preventative care services. By ensuring that all Oklahoma, regardless of their income or background, have access to quality healthcare, we can prevent and manage diseases more effectively, ultimately improving the well-being of our communities. Third, and perhaps most importantly, Medicaid expansion is a matter of equity and social justice. For too long, vulnerable populations, including low-income individuals, minorities, and rural communities, have faced significant barriers to accessing health care. Expanding Medicaid is a crucial step towards addressing these systematic inequalities and ensuring that every Oklahoman has an equal opportunity to lead a healthy and productive life. I urge our policymakers to prioritize Medicaid expansion and make evidence-based policy choices that benefit all Oklahomans. Let us learn the successes of states like California, Oregon, and New York, where Medicaid expansion has led to improved health outcomes, reduced uninsured rates, and economic prosperity. Together, we can build a healthier, more equitable, and more prosperous Oklahoma for generations to come. So let us seize this opportunity and embrace Medicaid expansion as a catalyst for positive change in our great state.